As CAR T-cell therapy has become available both in second and third line and beyond for patients with aggressive B-cell lymphoma, its use has become extensive. And most of patients, more than half of patients, require bridging therapy before CAR T-cell infusion. We're now finding ourselves in a new scenario where bridging therapy can be very effective, resulting in complete or partial responses before CAR T-cell infusion. That raises the question whether those patients should proceed with CAR T-cell as planned, or rather they should proceed with autologous stem cell transplant. There's been a large study, multi-center retrospective study led by CIBMTR, suggesting that patients who are in PR should probably receive autologous stem cell transplant rather than CAR T. That could sound counterintuitive. If you look into the publication, in my opinion, the group that received CAR T-cell was a higher risk group. They also reflects our practice, which is that we will usually send to autologous stem cell transplant patients who have a good response to treatment and where we think that the tumor burden is small enough for transplant to be successful. And we typically send to CAR T-cell patients who have more aggressive disease, as we know that CAR T-cells activity is not dependent on response of tumor to the previous bridging treatment. So because of this, we decided to look into our own single center experience, and we interrogated our database asking whether the amount of disease present at time of PR before CAR T-cell infusion or stem cell transplant matter. And what we found is that what seems to matter is the type of response to previous treatment. So if patients are in PR because they are chemosensitive, there will be a marker, a surrogate marker for his subsequent response to stem cell transplant. But if PR is not reflective of that, these patients may have a better outcome with CAR T-cell treatment. And TMTV, which stands for total metabolic tumor volume, which is a PET-based parameter, may help to identify patients who may benefit more from one or the other.